Hey, it's Chris Bowling.
Hey, it's Chris Beyer.
What's happening, CB?
Well, we are again in October. We are starting to deliver benefit renewals for 1/1. We've had a lot of strategic conversations with our clients, our prospective clients. Talked a lot with our CFOs about, topic we shared in a prior video, healthcare supply chain.
Yes.
How is the business purchasing the components of their health plan to be as efficient as possible? I think we wanted to expound on what it means to have a network on your health plan. It's
Right.
a broad topic.
It is.
And, I wanted to talk about the broad network. So we have a lot of employers as clients that have multiple locations, multiple states. We have had to historically rely on a carrier that has a broad national network so that employees have access to providers in their geographic area with little disruption. Good or bad, that exists. And most of those networks are negotiated. There's a price, here's a discount, here's the final number.
Yep.
I think the question has come up, how do we get to that final number as we're helping an employer say which network is best? Who cares what percentage it's discounted? What's my dollar amount? What goes out the door?
Right.
And so we found that we've helped some employers that maybe had some smaller networks that weren't as efficient move to something that was more efficient so
Yes.
that the health plan is truly paying less cost for that procedure than they would have in a prior network. But we take it another step further into what we consider a direct contract or direct network. If you want to touch on that.
Yeah, I think anytime you can remove insurance from that equation, you can
Yes.
reduce cost. I mean, we've talked about this before. A lot of providers, especially independent providers, their non-facing patient population is outgrowing their
Yes.
patient-facing population. Why? Insurance, Medicaid, Medicare, work comp, it is a ton of work to go through prior auth to try to get paid. And then to
Like
find
for the
out,
patient,
okay,
yes.
yes, it got approved, but now you're clawing back some money because maybe we didn't fully understand what was being done during that procedure. Hence why direct contracting is getting so popular is it could be MSK related, right? I mean, there's all kinds of options out there to once again carve it out of your medical plan. I don't mean carve it out as it's not covered, just find a better way of supplying those services to your employee population outside of your self-funded or fully insured plan.
Yeah. So instead of saying we're going to bill it at a rate, have it discounted, pay a number, we're just going to agree on the number to start with for whatever that procedure, that surgery, that
Yes.
episode of care would be, and we're just paying that directly.
Yeah,
I know
and
you found it simpler for the employee, the employer,
oh,
and for the provider,
way
but
better.
it's also a component of we still need that maybe that bigger network for other things that could happen, but give the choice.
You do because typically direct contracting is going to be for a elective procedure, meaning I have
Yes.
time, right, to find the right provider in the right location.
Correct.
Where emergent, that's where you have to have that network, right?
Yeah.
Because you don't have time to do that research. I'll go one step further. Centers of excellence have been around
Yes.
forever. AP has one, right? I mean,
Yep.
there's plenty of them out there that we're finally realizing that if you've got a rare cancer, where is the best place to go in our country for that cancer? Same thing
Yes.
with orthopedics. Same thing with
Heart
cardio.
surgery. Yeah.
So it's so just buying from a carrier or a independent TPA, relying on the network to be your sole option is now outdated.
Yeah.
You are
I would
not
agree.
you're not performing at the highest that we would want you to perform to say, sure, that's the core, but what do we add into that core that's now going to make the plan run
Yeah.
better and be better for your employees?
And I would add one more that we're seeing starting to happen more in our market. Again, rural Illinois and Iowa, not as much as reference-based pricing,
Yes.
where the health plan is going to reimburse the provider a percent of what Medicare would reimburse. Just here's what we're going to send you, and it's accepted or not. And we haven't had a huge success with that yet in the market because a few providers just don't want that dollar amount. So when we find providers that do, it's worked very well to control cost. I think where we're seeing it work well is that the provider and the reference-based pricing organization come up with that number together, similar to a
Yes.
direct contract, and say, this is what we're going to do. Do you accept it? Is it fair? Rather than put the patient in the middle of it. But at the end of all of this, it's what dollars going out for the health plan for that procedure is as efficient as possible, and do we make it as simple for the employee as we possibly can? And you're right, it's outdated just to rely on the health network and a self-funded plan
Yeah.
that's built in to get the job done.
Well, great. I mean, again, there's so many options, hard to cover in less than 10 minutes.
Yes,
But
absolutely.
this is a very broad overview. I think the bottom line, if you're just relying on a TPA or a carrier to provide you with a network, you're probably not maximizing the full potential.
Yeah.
It's out
There's
there.
definitely a better way, and it
There's a better
deserves
one.
to be researched.
Agree.
All right. Thank you, CB.
Outstanding. Thanks for sharing.
All right. We'll see you.
All right, we'll see you. Bye-bye.